Hi, so in this video I'd like to talk about the seriousness of septate uterus or uterine malformations in general. So septate uterus is the most commonly diagnosed form of uterine malformation, and it is often left undiagnosed or misdiagnosed because it is very difficult to actually spot with the naked eye. Even after going for several scans or tests or x-rays, you need an expert trained eye to actually identify a septate uterus. Now, we've had several patients here in Singapore, and they all have a history of ectopic pregnancies and an early miscarriage, and it's all caused by a misdiagnosis or an undiagnosed septate uterus or a naive uterus. Now, this all can be prevented, so they didn't have to go through these miscarriages to actually learn that they were having a septate uterus. This septate uterus had to be diagnosed in the first place, but this is not being done, and also not much emphasis or awareness is being done in the medical field with regarding this septate uterus as to how serious it is. Now, we've had a recent patient here who also had an ectopic pregnancy and also an early miscarriage, and we are highly suspecting that she had also a similarly undiagnosed septate uterus. Now, this patient has already had to undergo a removal of a left fallopian tube. Now, she was also further recommended by her doctor to go get pregnant, but this jeopardizes her right fallopian tube and also her last remaining fallopian tube, because if she doesn't get the septate uterus treated, she might have another ectopic pregnancy again, and then she might lose her right fallopian tube as well. So we need to see how serious this is, and before you get diagnosed, please don't get pregnant. You need to make sure that you do not have any uterine malformations, no problems with the fallopian tubes, because you don't want to lose certain organs of the reproductive system because of ectopic pregnancies or a miscarriage, because it significantly reduces your chance of getting a healthy pregnancy. So in conclusion, septate uterus, naive uterus, although it's very difficult to actually diagnose, does not mean that we should not put an emphasis on it, because it usually is the most common cause of a miscarriage or ectopic pregnancy, and it is fully preventable as long as it's diagnosed properly and also you receive the appropriate treatment.